Sangamesh sir is with us. I wish to welcome you here, sir. He is a BMS MD and PhD scholar and assistant professor in the Department of Panchakarma in SS Ayurvedic Medical College, Haveri, Karnataka. We are grateful for your presence and very thankful that you could make time for us out of your busy schedule. I hope webinar will be good and informative to all of us. So starting with the first day of our webinar series with our first topic, that is Jalaukavacharana and Anushastra case studies. Before starting, I would like to introduce some rules to the participants. Please keep your mic off during the presentation. If you have queries, you can put your question in the chat box. It will be discussed later upon according to the time. So, without wasting much time, I will request Dr. Sangamesh sir to start with today's webinar. Over to you, sir.
Yes, good morning to all, sir. Good morning, everyone. It's a pleasure to have such a wonderful series, and I'm going to present now. Today's my topic is Anushastra as a case studies, Rakta Mokshana as a case studies, whichever in day-to-day routinely, whichever I come across in my OPDs. Anushastra as Jalaukacharana is practiced. That's what I want to explain, and I want to take in this entire series. And now I want to start with the topic presentation. Is my screen is everyone, please? Sir?
Yes, sir. It is visible.
Am I audible to all?
Yes, sir. You are audible too.
Yes. Thank you and good morning to all, sir. And today's topic, whatever I'm going to take, is Anushastra as an parasurgical procedure in day-to-day clinical practices. The Anushastra is a combination of two words. Anushastra is often two words which is combined with the Anushastra is an important surgical practice of an Shastra Karma which is practiced throughout our ancient ancestors, and the Anushastra is a parasurgical procedure described by our Acharya Shashwata in that the Jalaukacharana. And I want to first tell you that it's not a Jalaukacharana, Jalaukavacharana. And next, there is a procedure separate from an major in those conditions where the Shastra Karma used to get which is used, Shastra Karma, Anushastra, which is used in sensitive patients. It's a traditional parasurgical method of an procedure which is used with a lot of build changes. It has gotten the best importance. In that, with the Anushastra of the Jalaukacharana comes in the main heading, the Rakta Mokshana. Rakta Mokshana is a therapy or the bloodletting therapy. It is called as the bloodletting therapy or the blood cleansing therapy, which is used to purify the blood, or the purification. Also, it is called as a purificatory therapy. It is therapeutic cleansing process given by our acharyas. It is one of the essential parts of Panchakarma, healing treatment. It is process by which the blood detoxification. It is derived from the words rakta, means the blood. Mokshana means to live, and Rakta Mokshana to let or to blood let it out. The blood is held in body to reduce quantity of toxins and next the disorders of blood. However, it is generally recommended in patients, and because it involves a certain amount of risk factors, more cleansing and detoxification process is continued. And next, my topic today, I want to give a brief introduction regarding my topic regarding this Jalaukacharana. I want to start with my topic, the practical application of Jalaukacharana in different clinical conditions. Where and all the Jalaukacharana or the Rakta Mokshana is clinically I will be having a lot of cases. I am having a lot of cases whichever I have been practiced with the practical, with the ethical evidence, with the classical references. I am going to explain you all about the Jalaukacharana and its different clinical conditions. Where and all in the general practice, in day-to-day general practice, where and all the practical application of Jalaukacharana is practiced in different clinical conditions. I want to explain and least the Rakta Mokshana, Jalaukavacharana is a clinical application which I am going to explain it. And the Jalaukacharana is often 2 words, and my contents will be the indications and specific advantages in Jalaukacharana, Jalaukacharana Vidhi, how it is done, and case studies, which I have got a vast clinical experience in this Jalaukacharana procedure, whichever I have been used in my day-to-day practices. And lastly, I will end with the discussion and conclusion references. And first, I am going to start with an importance of an leech in Ayurveda. What Mantri is a Vaidya of God. The Dhanvantari brought the knowledge to a knowledge of surgery to her. One hand, Sri Dhanvantari holds the leech, a parasurgical instrument. Acharya Shushuta, Indian surgeon, known as a god of father of surgery. Now also, everyone praise the Acharya Shushuta. Sutrasthana, it has been got and reference the Shushuta Samhita based on the importance of last surgery. Sutrasthana, interestingly, Jalaukacharana, it has been referred and it has been explained in the whole of there. Is a full of scientific knowledge about the leech and its applications. And Rakta Mokshana, as I have been explained, the Rakta means the colored, or dyed, or tinged, or painted red crimson blood. It means the colored red or the painted or crimson red blood in color. Mokshana means the derived from root moksha, means Raktasya Mokshanam Raktasravaha, letting out of an impure blood from the body, where the toxins of a certain local area, toxins from are the doshas, are the kapha, are the pitta doshas, whatever presence in the local part, it will be relieved from a certain sthanika sthana. And next is the Rakta Mokshana refers to blood-letting therapies, the process elimination of vitiated doshas which are accumulated in a certain place. Jalaukacharana is an effective blood therapy in which carefully it is controlled and removal of a small quantity of blood is conducted to neutralize the accumulated vitiated pitta and rakta doshas. Our Acharya Shushuta has been explained the rakta as a chaturtha dosha. Hence, the vitiated pitta and rakta dosha of many blood-borne diseases are cured by an Jalaukacharana. And next specific a reference with an Shushuta Sharisthana 7/16. Nahi vatam shirak kaschin pittam kevalam tata sleshmanam va vahanteta ataha sarvaha smratam. Means Acharya Shushuta calls blood vessels not only the blood vessels, not only the blood flows there. It's on sarvavahasira. It has been called as sarvavahasira. Since rakta, vata, pitta and kapha, all these doshas flow there, Hence, the Rakta Mokshana is an ideal treatment, not only for doshik, not only for Rakta Dhatu, and it's also a doshik imbalance or the toxins and the dosha which are present in local surrounding places. And Rakta Mokshana Bheda, the classification of Rakta Mokshana is Shastra Visravana. First one is Shastra Visravana. Prachana in several incision and pricks. Siraveda in vein, Siraveda which is called as an venous puncture. Anushastra Visravana. The Jalaukacharana through Leech, Pitta Dosha, where the dominance of Pitta Dosha is there in certain conditions. Alavu is an extracting blood through vacuum, Kapha Dosha. And Sringa is an the cow horn, which is used in Vata Pradhanams. And next, the Jalauka, its name itself it explains. Jalamasam Ayuriti Jalauka. Jalamasam Ekaiti Jalaukasara means which resides in Jala. Since Jala is their life, they are called as in Jalauka. Since they are habituated to water, they are called as in Jalauka. Jalaukacharana is described under Rakta Mokshana, explained under Panchakarma by our Shishruta Acharya, and the Panchakarma is an the Rakta Mokshana is also involved in Panchakarma. It's one of the Panchakarma therapy, which is also called as Jalaukaso Anushastranam. Also, according to Acharya Charaka, it's also called as an procedure. And types of Jalaukas. Savisha, the Krishna Karpura, Bhagavata, and Samhita, and Godha, and Nirshaka, and Mushaka, and Savarita. Likewise, explain. Next, the specific thing, whatever the things to be concentrated, that's what I'm going to explain. With the brief concentrating on my clinical experience, case studies. And next is speciality and mode of action of an Jalaukacharana. Jalaukacharana involves the initial beat with the leeches, which is usually a painless bite, followed by sucking of 5 to 15 ml. Thrombolytic, which is called a thrombolytic effect, the clot destruction. And when leeches bite, they create a bit of an lymphatic system from it, inflammatory and anti-inflammatory, strengthens the tissue immunity, and also leech sucks out the blood and sends out. It's an important thing that it sends out the Hirudo, prevents the blood coagulation. It also is called as an anti-schematic, improving blood supply in certain tissues and organs. Anti-hypoxia improves the blood circulation, blood supply and oxygen, and it reoccurs the fresh blood in local area. And draining of blood with the lymph system, toxins are removed and blood clots are removed. Restoration of a microcirculation and restoration of an vascular permeability will be there. Recovery of a neuromuscular impulse transmission. These are all the characters, these are all the qualities you will see in my case studies in forthcoming, whichever I am going to show you. Thrombolytic, anti-inflammatory, immunostimulating, raises nutrient to tissues, strengthens the tissues, immunity, leaches the blood and sends out the urine. It's the blood bag. Bloodletting therapy may be done, but what is the need of an Jalaukacharana? Here, no need of influence, no need of an antibiotics, painkillers. Also, extinguishes the pain. The local anesthetic action. Jalaukacharana ability to suck and improve the blood and bottom of the deep liver. Ability to purify the tissues, increases the swelling, distance and refining the swelling. Jalauka has ability to transformation of an stages. That's what the indications Acharyas has been told. Nupa Adya, Bala, Sthavira, Durbala, Nari, Sukumaranam, Anugrahartam, Paramasukumaro, Ayam, Shonitavasochana Upayo, Abhihito Jalaukasa. Means the Jalauka is used in Nrapa, in king, in the person, Bala, Durbala, Nakumara. And next the Jalautu Sukinam Raktasravaye Yoji. According to Vagbata, Acharya, 26th by 35th, the Jalaukakarana is indicated in Sukina. Delicate individuals, the patients who are delicate, who are accustomed to hard strips, who is not accustomed to an hard strips, who is not hard, who is sukshma, who is prakriti and pravritti. And the Ashtanga Sangraha has mentioned the disease where the Jalaukacharana is indicated. The indication of an diseases in Gulma, Arsha, Vidradi, and Kushta, and Vatrakta, Galaroga, and Netraroga, and the Vishadanta, Visarpa, likewise it is indicated. And next is the indications Vidradi, Ekadosha Shofa, Slipada, Visarpa, Arbuda, Granthi, Stana Roga, Oshta, Krimi. These are indications. And where are the complications? Sarvanga Shopa, where the show is there. Where the patient is enemy is suffering from Panto. In case of an Arsha, Udara, case is there. Where the infection is not. In show, where the show of the patient Pakshagata. Where the dehydration, all the electrolytes will be loss of all the electrolytes. These are a case. Where the patient is the virikta, or where the omana is done, where the patient is suffering from in chardi, if the patient is suffering from kamala, and next in case akshipaka, where the kshina patient is there. In such a cases, the contraindication of an raktamoksha is there. And to the modern aspects, where the absolute hemophilia patient is there, where the patient is HP lower than the 9, or the severe anemia. Erosive gastritis, where the GIT bleeding, where the peptic these ulcerations, where the ulcerations are the bleeding will be there in certain conditions. Where the potential gastrointestinal bleed, Urdhogata and Adhogata Rakta Pitta is there in certain conditions. During the chemotherapy, where in post-chemo conditions, the pre-chemo conditions, where the patient is suffering from so many viruses, like an HIV infections, where the individual in CA cases, in such a conditions, the contraindications. Where the patient is very allergic to dialysis, allergic to foreign proteins, in such a cases, the contraindication. Then say hypotension, where the hypertension, acute tuberculosis, mental disorders, where patient monosrota dishti is there. During the acute episodes, severe ill and bedridden cases. Extremely in certain conditions, the contraindication of an certain these Jalaukavacharana is contraindicated. Jalauka, Haridra table, and the gauze cotton needle, kidney tray, Estimaduchuna, Sendolona. These are all the requirements, are the materials, whatever used in the Jalaukacharana procedure. And next, the procedures. You may see in the figure, first figure, the leech is taken within the tap water, whatever the storage is there. From that, the leech is taken. It is made into an active when the Haridra water, and it is made pure, and it is taken to matches itself itself, you should try it. And if at all it is not getting to hold the skin local sthana, you should with all aseptic precautions, with a needle it is pricked and made into a blade, some sort of a blade, and the leech is made to apply there and made to hold the certain local area. And after a blade, it is the leech is after where the stand after such a certain place, the leech is where the leech is left out and it is taken and the woman often leech is there, and these are all the post preparations. Abhyantara sneha and local areas are made the aseptic preparation. The program from a cast the leech we can close whatever I have been explained till now. And if the pain starts local area right in between place where the fresh blood is taken and remove the applying rock to its mouth, and it is left out and the leech is done and it is stored. And next, the Paschat Karma is consist of Jalaukavacharana, whatever I have been explained now, Pathropchara, where the blade is to be controlled. It's informally it is tied with all the aseptic precautions. And next, I am going to enter the sort of whatever I have been explaining, a case studies of in Jalaukacharana. First one is a case with the protocol. You may see before and after, before the and photo, the case of an immunity. Means where the ruha is there, where the total dushti is there, where the condition, no other surgical procedures, no other the blood pressure therapies are done here. These are in certain conditions where the face itself where and certain eyeball is there, the leech is applied. We cannot make the wound here. We cannot take an incision here. We cannot take bleed or blood letting therapy. Other procedures are not done here. But the leech is the only parasurgical procedure which is done very beautifully. That's what I am explaining in photo. Within 2 settings, within 48 hours, we have got the result here. Within hematoma case, which has been which have been done, which have been practiced in our clinically, with the 24 hours or 48 hours, with the 2 settings only, we have got the hematoma relieved from an eyeball. No other surgical procedures has been done here, but our leech therapy is done within and next, remedy the hematoma condition as the been hematoma conditions are done before and after 4 procedures. And a burning aspect, case number 2 is Mukhadushika. Visheshachardhanam. Acne is a burning problem with the youth. It's a pitta disorder where the systemic pitta is circulated over the circulated over body. It is accumulated in skin, capillary burst, or cause acne or bumps. So, not useful. You with treatment of Jalaukacharana are least faster and faster relief through that only, because the pitta dushti are the kapha dominant dushtis are the pitta kapha dominance, the dvandva doshas are presence there. Hence the treatment with Jalaukacharana is very much effective here. Hence, because the youth generation hormone level will be high due to stress, anger and high, they also increases the pitta. Hence why it is very much applicable, very much suitable in Mukhadoshika. And next is, you may see the Mukhadoshika before and after photos, before and after treatment photos you may see here. And the two either cases which have been done, one in male and the other the female case, you may see within 5 days, within a third setting only, you will get the results within Jalaukavacharana. And next, the case is in Kushta. Third case is Kushta. The Kushta has got an elaborate topic, which is the elaborate topic where the Jalaukacharana is used very much effectively. Vatottareshu, Sarpin Vamanam, Sleshmottareshu, Kushteshu, where the, in case of in predominance of Vata, Vamana is indicated. Pittottareshu, in case of in Pitta, where the Jalaukacharana is also indicated. Prachinnam Alpam Kushtam, Virechedva Jalaukavihi. Likewise, so many conditions, so many cases, like in psoriasis, you may see the before and after photos. In case of an kushta, you may see the here before and after photos. The Kitima kushta, you may see here. It's the before and after photos, by which the Rakta Mokshana is done, Jalaukavacharana is done. You may see the results here. And before treatment, after treatment, how the lesions, how the dominance of Pitta and Vata, how the bleed, are the erosions, are the Daha, it has been reduced, and the lesions, how it has been get cured. And next is widely used in day to day, we will find the more over case, the itching, where the Vata or the Pitta dominant disease, where they bleed within certain wounds, where the Prachinnam Alpakushtam Virechedva Jalaukavihi. With then Virechana, with the associated Virechana Shodhana therapy, you may do you may see in the figure, the Vicharchaka, in case of an Vicharchaka with the result before and after treatment, the Jalaukavacharana. And next, in case of an VRANA, in case of a VRANA, where the Shofe Vranechak Vivarane, Vedananvite, Vishayukte, Visheshana Jalaujadho, Haret Asrat, Drashte, Astre, Apagate, Sadde, Shofa Ragarujam, Shamaha. Likewise, I have been a very well experienced with the so much of an infected wounds, where the Dushta Vrana, I have been used to use the more over Jalauka therapy or the Rakta Mokshana in the infected wounds, whether within the diabetic mellitus or it may be without non-diabetic cases also, more or widely we have so much of we found the Dushtarana cases. You may see here the case within the Dushtarana before and after treatment within Panchalkala wash and within associated oral medications within the Gandhakrasana and the Ayurvedic or the Gandhakrasana within the Triphala Gula and all, with all the oral medicines, with the Jatayatana Lepa and the Panchalukla wash, associated with them, the parasurgical procedure, Jalaukacharana is done, hence we have got the good result with the Dushtarana case. You may see in the figure, diabetic wound improved with the Panchalukla Pathan Jatayatana application with the least therapy. Alternate days, for the 15 days we have got a good result in certain cases. And next, you may see here where the arterial block was there, where the venous block was there. One of the cases is the angina pattern, who was advised amputation of a certain leg, and we have reduced the amputation. Of course, the amputation was done, but we have reduced the amputation of a certain leg. Before and after, we may see the colors of varied colors in such a conditions. Before the blackish, grayish color we may see in it, and there is a palish, whitish, or the redness seen in food coloration. You will see in before and after. And next is Indra, very much burning aspect, which is an Indra is Siddham Swinness where the toxins are present, the doshas are present in local place. After the third or fourth day, the Rakta Mokshana is done. Jalaukachana was also done with the oral medications. We got the results in Indralukta case. The hair regrowth is seen in a figure, you may see here. With the loss of hair in before treatment and hair regrowth is seen in an Indralukta case. And next is Shvitra, another interesting case. The Shuddhya Shronita Mokshe Virukshanahi Bhakshanayischa Kasya Chideva the Prashamiti Kshina Papasya. With the Kshina Papa, with the Purushanma Kate Papa, the Shvitra occurs there. In such a case of within 16 years male who has gotten Shvitra lesions, you may see beautifully before treatment and after treatment, you may see here. In this figure, after treatment, there is a white hairs which has been converted into blackish hairs. You may see in that figure. Of course, it has been treated with an with a 1.5 month treatment. With a 1.5 month treatment. In that, with the Jalaukavacharana was also done with the oral medicines, with the applications. We have got the result with the in case of a Switra case. And next is Sirag Granthi. The Sirag Granthavu Namepeyam Tailam Sahacharam Tata Upanamahu Inivaharaihi Bastikarana Siravedaha. Siraveda is also explained, and in case of the Sirag Granthi case, we have done the leech therapy, we have got the relief. The tingling sensation, Siras. There is a reduction of an edematous siras, we may see in the last figure. Whichever clinically we practice in Sirag Granthi case, the Jalaukacharana. And in case of an Venga, in case of an Venga case, with the blackheads, the black discoloration over the face, in the cheeks. Netche Venge Siramoksho Nilikayam Cha Shasyate. In Shishutsanta Chikitsan 20/33 chapter, it has been explained. The Netche Venge Siramoksha is done. Nilikayam Chasashate. Where with the leech therapy you have got the discoloration, where the Sthanika doshas has been relieved. The blackish discoloration has been disappeared in after treatment photo. You may see here. And next is Kunaka. It's a very interesting case. We have got the Kunaka disease. In case of a Kunaka disease, Dushta Rakta. Where the Dushta Rakta Kunaka Vidurapesha Karyahi Vishlam Bhave. Dushta Raktapagamano Sadh Raga Rujam Shamaha. Raga Ruja has been relieved. Raga Ruja has been disappeared. You may see here the Kunaka, through which the Kunaka has been relieved. The doshas, Puya, are the Strava. It has been relieved in certain way. Through a Jalaukacharana procedure, through a 5 to 6 settings of a Jalauka on alternate days, on third day once or 4 days once, we have got the results. Within all the aseptic precautions, dressing was also done. The mild applicables also given. With the leech therapy, the Kunaka is being relieved. There was a deviated growth of a nail here, where the Kunaka was, the symptoms were seen, where the strava and pain was there. Through a Jalaukacharana, you may see the results. And next is Shotayukta Vrana. Vrana, which has been got very much Shota. All the clinical features of Pittaja, Vrana Shota were present. The swelling of a Pittaja, Vrana Shota, slightly yellowish, reddish discoloration of a skin, you may see in the figure. And next, the severe burning sensation, hot fumes, are the bubble sort infections, are the rashes were there. The leech application Jalaukacharana is followed by some sort of an lepas also. The Jalaukacharana has been done. The swelling or the edematous, pain, burning, the oozing, everything has been relieved. Patient got admitted for 1 week in our hospital, which has been treated with all the oral medicines also. Now the patient is well, where the Shotayukta Vrana is relieved. The Vrana is being healed up, and the Shota is also relieved now. And next is PYOGENIC granule. It's a case with a pyogenic granuloma. It's a case a 54 years female who was being infected, who had an she is a female case who she had an the unhealed wound. She has went to all the hospitals and taken treatment. All the antibiotics has been tried. All the applications has been tried. Current 6 to 7 months, the wound was not healed up, and with the touch only, it starts bleeding. It's some granulomar mass which has been developed over the plantar region in the below the finger. She was unable to walk. She used to have a pain, burning sensation, and very much irritancy in certain wounds. Through touch only, she used to get the bleed. In such a conditions, pyogenic granuloma, the skin grows. That is a small, rounded, and usually body-headed in color. They tend to bleed because they contain the large number of blood vessels. There are known lobular capillary hemangiomas or granuloma was present. In such a case, it has came to our OPD. We have been tried with them. We have been treated with them. The Jalaukavacharana here with an alternate days, oral medicines, Kaishora and Teflopro, with them. The leech therapy on alternate days for 10 days. The complete heal-up was there. There was a reduction in granulomar mass. The wound was healed. Now patient is free from wound and pain, bleed, nothing is there. You may see in the figure. And conclusion, last, the Jalaukacharana is adopted mainly in Pitta dosha predominant diseases. One of the best Anushastra Chikitsa used in and mainly in Rakta Pradosha Vyadis, where the Rakta and Kapha dominance diseases. And through the action localized but affects the whole body by releasing the many factors into blood. Also safe, it can be used in communicable diseases due to presence of specific factors, and less time consuming, cost effective. The poor people can take it, easily adoptable in all the cases. Leech is one of the beneficial delicate, and the treatments, and it is very much cheaper and short procedure without obstructing the patient's daily routine. Leech is applicable in best because they get easily applicable, quicker reliever, purificatory in nature. And also, it's on pre-surgery precautions like anesthesia, antibiotics are not necessary. Patient does not feel the major surgery is done. He will have surgery has been not done like that. The leech sort of wound as best parasurgical instrument or the cosmetic instrument, you may call it as a cosmetic instrument. In certainly short indigenous leech, in spite of an migraine from a much famous in medical field. The references you may get in the Shushal Samhita as a Jalaukacharana and in Ashtanga Samhita also, in Charan Samhita also, you may get the reference, very good references. Thank you. Thank you.
Thank you for this informative session, sir. I'm sure each one of us have learned a lot from this session and will definitely apply it in our practices. So, without wasting any time, we just move to our question session round.
If there is any queries, you may ask.
Yes, sir. Sir, first question is from Yashodan Ashwin. As you said, Jalaukacharana remove toxins from the lymph. So, can it be used in filariasis?
No, filariasis, there is an evidence of the classical reference for it, but till now, it has become a national program. In the certainly cases, like a polio, like a tuberculosis, it has become a national program. The filariasis has certainly, our government of India has been made an it's a national program. Hence it is, though the pitta dominance or the vata predominance is there, we may use it. Once at all, in some of the 1 or 2 cases we have used it, but it has gotten so much restrictions through our government rules, where it is also a communicable diseases. It comes under communicable disease also.
Thank you, sir. So next question is from Dr. Sridhar. Doctor, can it be used in scorpion bite?
Of course, but the scorpion bite, it's an moreover the Vedana there in scorpion, the local as an local anesthetic part, it will be removed. It will be local anesthetic effect will be there, but the dominance of an Vata, the Vata Vahana, where the Vedana within certainly throughout the extremities, throughout the leg, throughout the body, the radiating pain where whatever will be there in scorpion bite, it will be a dominance of an Vata, I think. It's related with a neuromuscular disorder also. It is related with the neurological disorder also. And hence it may give some symptoms may be relieved through that.
Thank you, sir. So next question is from Dr. Varsha Panchal. Will there be any scar mark left in Mukh Dushika after the treatment?
No, nothing will be there, sir. The scar will be removed, and through the oral medications, through the applications, it may be removed through all the lepas and all. Not much more.
Thank you, sir. Next question is from Dr. Shiba. Sir, the Kunak and Kukunaka is same or not?
Kukunaka is different. Kukunaka is I think it's an pediatric disorder.
Yes, sir. The next question is from Dr. Basanti. Sir, Jalaukacharana used only Pittas dosh or any dosh?
Pitta, it is widely used in Pitta dominant disease where the according to the Acharya Charaka, the dominance of an Pitta is also, the Rakta is also Chaturtha dosha, it has been called, and it is also used in Kapha dominance also in some of the cases. For an example, in case of an Vicharchaka, where the dominant Pitta characters, where the oozing or the oozing effects are from local areas, burning, these are all the Pitta dominant characters. Though the diseases of an Vata predominance, certainly the Pitta dominant characters symptoms will be also there, hence in certain conditions it is used.
Okay, sir. The next question is from Dr. Varsha. Can it be used in any hematoma?
Yes, whatever been explained in facial hematoma conditions, in facial hematoma conditions, depends on the places.
The next question is from Dr. Suchi. Sir, you have used multiple leeches in some cases. What is the limit of number of leeches? Multiple leeches were applied at single time or there was a gap time while applying leeches?
Yes, sir. There is an Anguli Pramana, there is an Sadhana, there is an 1 Angula, 1 to 5 Angula, there is an restricted place for using it. Depends on the doshas, depends on the specific doshas, depends on the toxins presence, infection depends on the infection, it is used.
So next question is from Dr. Melinda. Can Jalauka be applied on thrombosed piles directly?
Yes, it is used. Depends on the after an investigations. If it is indicated, we may use it.
Next question is from Dr. Kiran. Sir, is there any pre-procedure test like BT, CT?
Yes, it is done. All the viral examinations and the clotting time, bleeding time is done. Due to lack of the time, some of the points have been not explained. I am more concentrated on the cases whichever have been done practically, though rather than the classical procedures. It's all the pre-procedures, pre-investigations to be done. CTBT clotting time and bleeding time should be done. All the virucidal should be done.
Okay, sir. The next question is from Dr. Himani. Can we do Rakta mokshan in leukemia?
No, sir, we can't do.
Next question is from Dr. Sonal. In Kunak patient, I tried Jalaukacharana but cannot get result. Patient got relief from pain but infection not subside totally. Patient was doing swimming before this for avoid recurrence. What we can do?
Those contraindications, indications should be maintained. The patient should follow the restrictions, whatever the doctor tells and doctor advises. He should be under medications, and we should try. We should tell all the preventions. What are the preventions to be taken before and after the procedures? We should advise the patient.
Thank you, sir. So next question is from Dr. Anshul Narula. Sir, it can be used in varicose veins or not?
Yes, it's used. That's what I've been explaining in the yes, I've been explaining.
Yes. The next question is from Dr. Yashodhan. What is the site of application of leeches in the cases of wound?
In case of
Wound.
In cases of wound, depends on the infection. Whichever I prefer is on wound only. It is very easily available. It holds the leech holds on wound easily. Rather than if it is not possible, if the wound is pussy or is not eligible or the wound is not the eligible place to they put the leech there, you can put beside that where the more over the Rakta Dushti or the venous presence, when Dushti is present, you may practice the leech on certain places beside that wound.
Next question is from Dr. Kiran. Sir, can it be used for muscular cramps and pain?
No, not so much. It is non-reserved currents. In some of the symptoms, you may get relief. Not in certain cases. It is completely a different symptom.
Next question is from Dr. Sonal. After history of all hematoma form, in how much time as early we can apply leech?
After getting in hematoma?
After history of a fall hematoma form, in how much time as early we can apply leech?
Whenever the patient comes to you, you may apply. After an investigations, after pre-investigations, you may do your treatment.
Next question is from Dr.
There will be a continuous venous drainage will be there. There will be a hematoma yet to be formed in the certain local place. After the investigations get done, you may do the certain Jalaukacharana.
Thank you, sir. Sir, next question is, can we use Jalauka in RA swelling condition?
Yes, we may use. In certainly conditions, some of the conditions, in Gardasi, in RA, in Sanjiva, also, that is widely used.
Next question is from Dr. Vijayananda. Whether used Jalauka can transmit infective disease like hepatitis, etc.?
No, sir, nothing. Not because the pre-procedures are, investigations are done.
Question. Sir, is Jalauka same Jalauka used in multiple persons?
Sir?
Is Jalauka may spread infection if same Jalauka used in multiple persons?
No, we are not using it now. In fact, we are not using Jalauka, same Jalauka in other person. The preventive measures are taken.
Okay, sir. The next question is it good to give food like till before leech therapy? Will it help?
Yes, the pre-procedure I have been explained. The Snehapana, whatever the procedures elaborately I have been not explained, but in pre-procedure I have been explained also.
Yes, sir. So next is in varicose vein, what is the site for Jalauka? Is it to be attached to the affected vein or near it? Please elaborate.
Actually, place of selection is below the knee joint we used to take, where the veins are visible, where the deviated veinlets are visible, where the swelling is there. Below that, we used to apply the leeches to get drained out of it.
The next question is from Dr. Shruti. Can we apply leech on psoriasis site directly without Ritvan and Virichan?
The procedure, the variation is there. That's what I have been explained. The Ek Kushta and Kideva Kushta, whatever I have been shown in clinical study have been tried, that's what the Snehapana and the variation of posture is done. In that case, only we have been tried. In that case only, certainly in that case only we have been tried.
Next question from Dr. Jitendra. What is the result of Jaloka in Khalitya and Palitya?
It's good only. In Khalitya Palitya only, it's widely used.
Next question is from Dr. Somya. Can leech be used in kapha predominant Kushth or only to Kittiv type Kushth?
Kapha dominant disease, it's used. In Kittiva Kushta, the Vata and the Pitta dominant, Pitta's sort of symptoms will be also there. It is used.
Next question is from Dr. Vijayananda. In cases of coagulative disorders, whether Hirudo or Leech affects the disease?
No, it does not affect.
Okay, sir. Questions are over. So, we are lucky enough so we get a chance of learning these concepts clinically. Special thanks to AIUTIP team, Dr. Deepak Mantri and Dr. Dipti Patil. Without them, this was not possible. Thank you for your time, sir. So, last question is there. Can leech used in fungal disorder?
In
Fungal disorder.
it is used because the itching and the infections oozing will be there. The Pitta dominant, certainly there are some fungal disorders. That's what the Vichachaka and the other conditions are used.
थैंक यू सो मच सर. मैं सर बताना चाहूँगा कि आज डे 1 कंप्लीट होता है. इसके बाद 12th of अक्टूबर को डे 2 रहेगा, सेम इसी टाइम पर, सेम इसी लिंक पर. थैंक यू सो मच सर. थैंक यू सो मच फॉर ज्वाइनिंग.
Yes, thank you and everyone. Thank you. I thank all the participants and the whatever the managing all the aspects, whatever the conduction part you have been taken the risk in gathering all the people. It's an exploration of all the Ayurveda knowledge. It's also to me and to all the participants also. Thank you and all.
Thank you so much sir.